On Morning in America, we are answering questions directly from our viewers like you. Some of you have had questions about well-being and mental health. I think all of us are putting mental health into focus. Employers are certainly paying more attention. In fact, a recent survey by Fidelity and the Business Group on Health found that employers are investing more in their workers. In 2021, 35% of the employers polled said that job satisfaction was a focus in their well-being programs. In 2022, that number jumped to 52%. For answers right now, we are joined by Daniel Levine, director at the Avant-Guide Institute, a firm that advises on trends in business, technology, consumer habits. Thanks so much for being with us this morning. I think the first question is, has the past 2 years made people like you and me prioritize their quality of life, their mental health more than ever?
There's no question that that's a major trend, Adrienne. The move has gone from people thinking about work-life balance to work-life integration, because work is not something different from the rest of our lives. It's part of our lives, and that's so much a part of what people are thinking about right now.
Yeah, and when you're spending more hours working than you're spending time with your family, obviously it's in firm focus. We have a question from one of our viewers. This is Guy Fragala in Florida. Let's listen.
With our aging population and a predicted severe shortage of caregivers, how can we introduce new technologies into healthcare which can provide tools to help these caregivers do the difficult work they need to do each day?
All right, what do you think?
Well, it's a great question, because one of the trends that I'm seeing is that mental health or health workers are not being treated for their own mental health as much as other workers. In fact, there's sort of a stigma around mental health and doctors and nurses. If doctors, for example, report that they're having anxiety and depression, that could impact their career in negative ways. And in fact, I'm seeing sort of a shadow pandemic in what's happening with healthcare workers.
A shadow pandemic?
I'm sorry?
You said a shadow pandemic?
Yes, like a shadow pandemic of anxiety and depression amongst healthcare workers. It's a very serious thing that's happening.
Yeah, I think that we need to pay attention to that with education. We need to pay attention to that in several sectors.
No question. But what I'm seeing is that specifically in healthcare, the people who are responsible for our health are not being taken care of as well as people in other sectors.
And that is certainly a priority. Let's have the well-being of the people who give us wellness. But let's talk a little bit about education. Social emotional learning, a method that helps students better comprehend their emotions, something that we probably all need to focus on, has been way up over the past couple of years. A 2021 report by Titan Partners, it's finding that schools and districts are spending more on social emotional learning between 2019 and at least 2021. Here's Guy's next question about it.
I know there's some controversy regarding social emotional learning, so my question is, how can we take what's good about this concept, integrate it into school curriculums, and address concerns parents?
Did you hear all that?
Yes, I did. And, social emotional learning is really about the kind of learning that kids do, or all of us do, that's not specifically about, math and science. It's more about self-awareness and relationship skills, social awareness. And what's happening now is this concept has become politicized, like so much in our culture right now. It's become part of the culture wars. And I think that the way that I'm seeing the trend advance is that more parents need to be involved in the education of their children. And of course, the United States, we're one country in many nations. And so it's really up to different parts of our country, our nation, to decide what's right for their children.
Yeah, and it really is about family time. I have friends who've decided to take some time away from their careers because they've seen some of the effects of the past couple of years on their children, and they want to prioritize this very crucial time in history and in their development. Daniel Levine, thank you very much for being with us and for raising some really great points to help us all think a little more. Thank you,
Adrienne.
Absolutely. And thank you to Guy for asking great questions. You can send us your questions. We'd love to get you on TV. I know you love it. Go to newsnationnow.com/answersforamerica. We'll answer your questions live right here, on Morning in America. We love meeting. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.